Hi everyone, my name is Jade Baker and this is my Educated Citizen Capstone Portfolio presentation. Within this presentation, I plan to discuss the public issue I have chosen as well as experiences throughout nursing school that show ways I've become an educated citizen. I also plan to use those experiences to gain insight towards ways to resolve my public issue. With that being said, let's get started. The public issue I have chosen for this semester relates to insufficient prenatal care. I wanted to begin by sharing the importance of prenatal care. Stanford Medicine 2023 states, the goal of prenatal care is not to provide the best care for the pregnant woman and unborn child, but also to prepare the mother-to-be for the delivery of a healthy baby. Prenatal care plays a big role in promoting healthy births and fetal development while also preventing complications. It ensures positive health habits are maintained and also provides education and support when it is needed most. I wanted to share some important statistics from the March of Dimes organization that show why prenatal care is important. In 2021, 1 in 9 babies were born preterm, 1 in 13 had low birth weight, and 26.6% were cesarean deliveries. The infant mortality rate was 4.9 per 1,000 births, with 1 in 11 women being uninsured. With this being said, Omaha has a preterm birth rate of 12.4%, which is a grade D on a scale of A through F. So overall, the Omaha, Nebraska area ranks really low for number of individuals receiving prenatal care, which goes to show that it is really something that needs to be fixed. Nationwide, our country is actually ranked really badly, which also helps recognize the fact that we need to do better. According to the Journal of Managed Care, the United States actually ranks the highest in maternal mortality and one of the worst in prenatal care delivery. And this was in a study done out of 11 developed countries. So it's really crazy to see how poorly the United States is ranked, even though we have so many advancements in technology and medical treatments and things like that. So it's really something that needs to be fixed. After recognizing the statistics of prenatal care within the country, it is clear that individuals are receiving lack of care and the amount of these individuals is increasing. I borrowed this plot graph from the March of Dimes, and it actually shows a plot of statistics from Nebraska specifically. And as you can see, it's just continuing to trend upwards, which just goes to show that this is a worsening issue that needs to be fixed, which is kind of one of the reasons why I chose this issue. But also, I chose this issue because I have such a huge passion for maternal and neonatal health, and I believe that it is really important to provide education to mothers during the prenatal period. As far as my personal connection goes, I have been working as a CNA in the NICU environment for the past 2.5 years, and I have also accepted a position as a future NICU nurse. I have gotten the opportunity to have firsthand communication and experience with those directly impacted by altered birth outcomes, and I have also seen the impacts and effects that lacking prenatal care can have on fetal outcomes. I also work as part of a team that strives to create the best outcomes possible for these babies while also providing families with things needed for growth and satisfaction. And so, overall, it is just really important that these factors contributing to this issue are addressed. For my effective communicator experiences, I have chosen to discuss events from levels 3 and 4. In this experience, I described entering the toughest semester of nursing school, which was Nursing 340, my pediatric class. Prior to starting the class, I was really nervous and scared because a lot of students were retaking the class, and it just seemed really intimidating that everyone was saying it was the hardest nursing class. I was very anxious and wanted to do good in my classes, so I reached out for help before the class started, reached out to tutors, supplemental instructors, and teachers for help and tips for things that would help me succeed in the class. Reaching out early really helped me pass the class and reach my goals for that semester. Within this experience, I learned that becoming an effective communicator helped me achieve my goals and allowed me to become more open to new ways of studying and thinking. This experience enabled me to use better critical thinking skills that helped surpass my expectations, focus on what was important, and also helped better connect myself to the material that I was learning. By learning to utilize critical thinking skills, I believe I could address my public issue through helping individuals at risk become better connected to resources that can help them obtain prenatal care. I feel that similar skills should be used to reach individuals at risk for not obtaining care through taking form of communication in ways such as written posters, education posted on streets, social media, and in stores near pregnancy tests, and also through doctor visits that people attend throughout life, just so that they are really educated onto the importance of what prenatal care is and why someone should have it. In my second experience, I was completing my clinical rotation in the ICU at Jenny Edmondson Hospital. And during this experience, I was caring for a ventilated patient who had severe acute respiratory failure. This patient required constant supervision and care by many different members of the healthcare team. This patient was also at extreme risk for extubation because he had extubated several times previously during repositioning. This made communication a crucial part of his cares, and being an effective communicator in this scenario ensured his needs were met and also that safety was maintained. This experience taught me that becoming an effective communicator is the best way to ensure patient needs are met and care is effectively distributed. It also taught me that communication is an essential part of developing therapeutic relationships and improving health outcomes. This insight learned from this experience can help address my public issue through teaching others the importance of using effective communication. I feel that this insight could also support my second proposal discussed in my public issue papers, which related to the fact that manufacturers producing these pregnancy tests and products should provide the education within their boxes. In doing so, I believe that this would improve health outcomes and more people would recognize the importance of receiving prenatal care and therefore hopefully obtain it in the end. As for my reflective individual experiences, I have chosen to discuss events from level 4. In my first experience, I talked about being in the beginning of my nursing 450 semester, which was my ICU semester, and I was really struggling with class content and ways of studying for the exams and succeeding on my exams. Throughout the semester, I was able to reflect back on my previous ways of studying and was able to dive deeper into my textbooks and class materials. With each exam, I was scoring better and receiving better grades. I began feeling more comfortable with content and making more clinical connections because everything we had learned in nursing school for me was finally being pieced together, which was super helpful. During this experience, I was able to use reflection to engage in different ways to think and act, which in turn benefited me and my success. This semester really taught me the importance of reflection because it helped me succeed in school and allowed me to develop new ways to connect what I had learned to real life scenarios. Reflecting on previous study habits and recognizing ways to improve had also allowed me to succeed as a person and allowed me to develop stronger critical thinking skills. Engaging in acts of reflection can help address my public issue through influencing new ways individuals react to the needs of the society. If we are able to recognize the factors that contribute to poor prenatal care, those factors can be better directly addressed. It is important to recognize areas of improvement and what could be done. That way, we can help best address the public issue that is worsening currently. For my second experience, I talked about reflecting on volunteering at the food bank, the community garden, and the mobile diabetes clinic during the summer and during the semester. Volunteering for these organizations allowed me to focus on how big the need for food was throughout the community and also allowed me to gain changes in perspective on the living conditions experienced by these vulnerable individuals. This experience enabled me to engage in new acts of kindness through making a contribution to society. By continuing to reflect on this experience, I am reminded of the reason that there is such a big need for volunteers in the community. I have learned that becoming a reflective individual is an important part of personal growth when thinking about ways that I had previously thought and done. In this experience, I became very open minded and shocked to see how big of a need there was in the community. And in many cases, it is often hard for people to realize the need when many of us have the necessities for survival. By reflecting on the needs of the community, specifically for pregnant mothers and these vulnerable individuals, we can help make resources more available and change what is currently lacking in society. For my change agent experiences, I have chosen to discuss events from levels 2 and 4. For my first experience, I talked about achieving my goal of working in the NICU environment. When completing my labor and delivery rotation during nursing school, I discovered my love for maternal and newborn care. Because of this passion, I had applied for a part time night shift job as a CNA in the NICU. I had interviewed and was offered the job, but I had declined it due to a fear of it not working out with school and being too difficult just with daytime school schedule and nighttime work. I just had a gut feeling that it wasn't right for me. I had reached out to the person who interviewed me, thanking her and also asking her to consider me if a casual position was ever created. A few days later, I was offered a casual position and I have worked there ever since. This experience has really taught me to become a change agent through creating a voice for myself, which in turn helped implement change in my life. I was able to utilize my strong interest in the position to stand up for myself and also fight for the things that I really wanted. I believe that my insights about becoming a change agent can help address my public issue by showing that we should all create a voice for ourselves and for others. Those who need prenatal care should have the availability to stand up for themselves and receive the care that they need, no matter the race, gender, or socioeconomic status. And additionally, healthcare professionals should always maintain a sense of advocacy for every patient to ensure that all of their individual needs are met. For my second experience, I was completing morning rounds and preparation with a charge nurse at the rehab center I had my clinical rotation at. And during medication preparation, we had heard a large crash across the hall. And on arrival to the area, we discovered a patient had fallen. We completed a full head to toe assessment, made sure there were no safety hazards in the room, contacted the physician to notify him of her fall. We sent her to the main Methodist campus for a CT to ensure no serious damage had occurred. And throughout the whole experience, we made sure she was okay and had all the things that she needed. It was really important to maintain safety and check on her frequently in this scenario. And it was also important to recognize the factors that had contributed to the fall so that it could be prevented in the future. In this scenario, I was taught how important it was for the nurse and I to create a voice for the patient and utilize critical thinking to provide her with the most appropriate care. Through these actions, we were able to become advocates for the patient and help initiate change. I believe that this situation has shown how powerful taking the initiative can be, and by analyzing current methods of addressing prenatal care, as well as the power dynamics of every society, we can best determine the factors that are preventing individuals from receiving prenatal care and recognize what can be done to initiate change in the future. In conclusion, my experiences throughout nursing school have really allowed me to become an educated citizen. Prior to starting nursing school, I had no idea what it meant to be an educated citizen. Throughout the past 4 years, I have learned to develop new practices that improve the ways of thinking and acting involved with becoming a reflective individual. I have been able to pursue constant acts of critical thinking that allow for the improved communication skills that come with being an effective communicator. And finally, I have learned to analyze the situations I'm taking part in to allow for advocacy measures, creation of new voices, and being able to take the appropriate initiative that is involved with becoming an agent of change. Not only have learning skills not only have these learning events that I have experienced helped me become an educated citizen, but they have also taught me how to be a better person as a whole. And with this knowledge, I am confident that I will be able to use my insight towards gaining success in the future, which includes succeeding in my career, continuing to help raise awareness about prenatal care, and overall just will help me make contributions to society and show the benefits of prenatal care. And here are my resources. Thank you.